primary reason for patients wanting to end their lives. In fact, it is not in the top 3. The Oregon Public Health Division recently released findings on the Oregon Death with Dignity Act. These findings suggest that among the top reasons that patients seeking lethal medication, pain is not included. The report says, as in previous years, the 3 most frequently mentioned end-of-life concerns were loss of autonomy, 93%, decreasing ability to participate in activities that made life enjoyable, 88.7%, and loss of dignity, 73.2%. Additionally, there were only 71 known deaths during the 2013 that were the results of the prescriptions for lethal medications, while more than 120 people were written prescriptions for lethal medications during the same year, while 28 of these patients did not take the medications but died from other causes in 2013. More than 20 people chose not to take the medications and had not died by the end of 2013. This represents a relatively high rate of patients changing their mind and deciding not to take the lethal medication. Also, 2 of the 71 who had died had been referred for formal psychological or psychiatric evaluation. So 15% of patients change their minds about receiving physician-assisted suicide prescriptions before receiving the prescriptions. In one study on the experiences of physicians related to the Oregon Death with Dignity Act, it was relieved that 15% of patients changed their minds about taking the lethal medications. The report states, of the 136 patients who did not receive prescriptions, 20% died before all the provisions of the Oregon Death with Dignity Act had been met. 15% did not meet the legal criteria for receiving a prescription, and 15% changed their minds. Many Oregon psychologists oppose the Oregon Death with Dignity Act. In fact, in a recent survey, a number of Oregon doctors openly expressed their extreme opposition in Oregon Death with Dignity Act. While most medical doctors who were surveyed were either not neutral or in favor of the act, a strong majority were highly opposed to it, and the majority raised serious concerns about the implications of the act. The researchers of this study conclude a minority were highly opposed. Most survey respondents raised ethical or practical concerns with the role as the assessors. Many important questions about how evaluations in this complex area should be conducted remain unanswered. Financial loss, worries, and pain are not among the most common reasons that individuals seek lethal medication subscriptions. A study on legalized physician-assisted suicide in Oregon reveals that the primary reason that patients seek such subscription lies elsewhere. The study states, during the first year of legalized physician-assisted suicide in Oregon, the decision to request and use a prescription for lethal medication was associated with the concern about the loss of autonomy or control of the bodily functions, not with fear of intractable pain or concern about financial loss. The patient worry of burdening families is unfounded. Many patients worry about burdening their families with high medical bills and responsibility of taking care of them. However, one study contradicts this line of reasoning and states, patients who received prescriptions for lethal medications were concerned about burdening their families. Their families, however, were considered less likely to be burdened by caretaking, including the cost of care, and were more likely to find positive meaning in providing care than were the families of other hospice patients. Thank you.